Good afternoon, everyone. I hope you guys can hear me. Thank you so much for everyone who's joined in person and also people who are joining online. And welcome to yet another episode of Conversations in Planetary Health. I know you all were probably expecting Renzo today, but I'm his colleague. I'm Muskaan Khepla from the Planetary Health Initiative at the Singh Health Duke-NUS Global Health Institute. And today's session is extra special because it is brought to you in collaboration with CORE and SPAN. While, of course, Renzo could not be here in person, he was called away due to a WHO conference. He has prepared a short video message to welcome us and set the stage. Yeah, David, can you?
Hi, I'm Dr. Renzo Ginto, Associate Professor and Lead of the Planetary Health Program at the Singh Health Duke-NUS Global Health Institute. I extend to you all, those in the room and in Zoom, a warm welcome to today's Conversations in Planetary Health episode. I fervently wish I could join you in today's discussion. In fact, this is the first time I'm missing this series, as I will be speaking in a conference on climate and health organized by the World Health Organization by the time you listen to this message. Nonetheless, I am confident that you will have a rigorous, vigorous, meaningful, and hopeful conversation to be led by my amazing colleague, Muskaan Khepla. The topic of today's conversation is of utmost importance and urgency. We in healthcare always aspire to become patient-centered, but we often forget our patients in our discussions and solutions. Planetary health threats, such as the climate crisis, affect our current patients, but also create new patients. How do we ensure that their voices are heard and that they are included in climate action? I hope that today's session will spotlight patient stories, highlight patient perspectives and aspirations, and propose patient-driven solutions. I thank our wonderful panelists in advance, Prabu Naidu, Cabe, and Khean, for the insights and inspiration. May this conversation forge the path towards patient-inclusive planetary health advocacy and action. Thank you.
Thank you, Renzo. Yay. Now let me please introduce our three incredible panelists for today. We have Mr. Prabu Naidu, who's co-founder of the Facilitators Network Singapore and also the co-author of Spot on Facilitation. With more than 20 years in MNCs and 25 years as an independent facilitator, he has trained leaders across Asia. Importantly, he also volunteers actively with patient advocacy groups in Singapore. Welcome, Prabu. We also have Derek joining us online from the Philippines. She's the coordinator of the Nuclear and Coal-Free Bataan movement in the Philippines. For over 30 years, she has been at the forefront of environmental and human rights work, from testifying in landmark climate cases to organizing communities against harmful coal plants. Welcome, Derek. We also have Yoong with us. He's an assistant professor at Duke-NUS, serving at the Center for Outbreak Preparedness and also Center of Regulatory Excellence. He's a medical doctor with experience in clinical care, humanitarian aid, and health policy, and he works extensively on patient engagement and governance for global health challenges. Please join me in welcoming our panelists. Okay, so I think we can first begin with an opening round of reflections. So Prabu, I would actually like to start with you. So you have been a patient advocate for many years. So could you also tell us a bit about your personal story as a patient and an advocate? Were there moments in your journey when your experiences intersected with climate change or sustainability issues? Yeah, over to you.
Thank you, Muskaan. At the moment, so I have a number of patient degrees, qualifications, right? So the latest one being colorectal cancer. 6 years ago, I was diagnosed, and then I've gone through the treatment. So the immediate recall would be my treatment ended when the pandemic started. You know, so I guess that's an example of a real in-person impact of planetary health situation and my own story. So that's the most reason. And as a result of that, I told myself I will want to give back to the community. And that's why I'm volunteering with the various patient support groups, including Sing Health Patient Advocacy Network SPAN, to see what I can do to make a difference. You know, as a patient and going beyond being a patient as a proactive patient.
Thank you, Prabu. I think I would also like to invite Derek now. So we all know that Philippines is one of the world's most climate vulnerable countries, right? And you have been a community organizer, a climate activist, a caregiver, and a patient. Could you share a particular story where those experiences came together in your advocacy?
Yeah, thank you. Thank you, and hello everyone. Sorry, I am not able to join you in person there, but yeah, I think looking back at my experience, I think repeatedly getting sick because of diseases like chikungunya. I had a chikungunya like several times already. Dengue, skin rashes, upper respiratory infections. These are diseases that I think and I believe can be linked to environmental degradation, to climate crisis, especially in the context of the climate being in crisis right now. So I think environmental degradation and climate change create conditions that exacerbate the spread of these illnesses, like chikungunya, for instance, and it has negatively impacted people's health in my experience. And as a community organizer, I see this. I observe this kind of diseases like proliferate for repeatedly. So even if there are treatments available, the symptoms reoccur again. But these diseases reoccur again. It happened every year. That is why we should understand that there is an underlying environmental cause that continues to expose our communities, our people to these harms or to these hazards. And I think in my personal experience, another point is the series of disasters resulting to climate impact change or climate crisis has deteriorated my parents' health, like stress and trauma. My parents, they're both dead, but now my mom had Alzheimer's. She had this after the series of floods, and with this cumulative effect, I mean, it can worsen chronic conditions on or lead to cyclical illnesses in the family. So with this, given this experience, my perspective on recognizing health and its linked to environment and exacerbated by climate crisis has strengthened. So I think we should understand that climate justice is also about health justice. It's like also it's social justice. So I think my lesson is that healing our environment is also part of healing the community's um health challenges. So that's all for now.
Yeah. Thank you so much, Derek. Those are really powerful points about your lived experiences, as well as like tons of health issues being faced by communities, right, who are impacted by climate change. Now I would like to call upon Yoong. So you have been studying patient engagement in policy making and advocacy for years, right? So how are patients and patient groups beginning to engage with planetary health issues such as climate change? And what lessons can we draw from past movements? Yeah.
Thanks, Muskaan, and very warm welcome to Prabu and as well as Derek here. Very nice to meet you. I think hearing from their experiences, their own lived experiences really highlights why it's important to have patient voices included in, as Renzo said, meaningful discussions and solutions. So my work around patient engagement mostly revolves around at the sort of regulatory and sort of health systems level. But again, as we sort of grow in this patient engagement landscape, particularly in Singapore, we can see over the years, patients have been very they want to participate meaningfully in different discussions, and we can see that their needs and sort of concerns vary across times. So this is something that we have to understand as well as we engage with patients. But we do see, from previous needs, from sort of looking at sort of the clinical healthcare system, how they access healthcare, how they access delivery systems. They are beginning to look at higher or broader level issues as well. Policy and obviously is one of them. So it's not really about just how do they get healthcare access, but how do we influence this decision making. I think planetary health is one of those things that is broad enough to include many sort of disease areas. And then we can see, again, from Derek and Prabu's experiences as well, how climate change, planetary changes and health changes affect their health and the health of the communities.
Right.
And I think as we sort of push together forward, we have to carry along the patient voices, and as we do that, they will get more involved and sort of help as well with the initiative. So I think that's my sort of preliminary thoughts as well on this.
No, that makes sense. And that's why I think we're having this conversation, right? It is important to include patients, especially when we're pushing for agendas which are for them. Okay, so I think before we start off with some guiding questions, you've heard their initial remarks. For people online as well as people in the room, if you have any pressing questions that you want to bring up right now, please feel free to. I will also monitor the chat online to see if we have received any questions for now. Okay. So if no questions, I think we can just start off with some guiding questions. And I think from all the questions that we received from the participants when they registered for the session, and also like our own guiding questions, we had like several themes that we wanted to cover in our conversation today. And one of the theme is, what makes this unique? Like, why is this different from other patient advocacy conversations or patient advocacy groups? So yeah, I think the question here is, what is unique or special about climate change or other planetary health issues that make them more challenging or perhaps easier for patient engagement and advocacy? And what sort of aspects do we need to consider? I think, Yoong, maybe if you want to start off and then
Sure.
We can move on to Prabu and Derek.
It's not a very easy question to answer. But I think sort of patient advocacy and patient engagement within the climate change and planetary health space is almost like a double-edged sword, right? At one point, so just want to re-emphasize my point that it is very easy and sort of easy to link different disease areas within the sort of effects of climate change, planetary health changes. And that's sort of the link that we want to bring up, that how does climate change affect population's health and your own personal health. But because it is so broad and slightly at the broader level, sometimes getting these direct links is hard. Because we know patient organizations, and I'm pretty sure Prabu as well knows better, that most of these patient organizations are disease specific, and they have specific needs and concerns that they want to address through their activities. This could be again from financial support, peer and psychological support, and access to medicine, etc. So we do have to really balance what are the broader issues that affect their health and what are the immediate needs and concerns. So again, just to re-emphasize, there is a sort of double-edged sword situation. But I think having this conversation helps, that we know that how the whole broader level affects the health of the population. And I think getting patient organizations to learn as well how to engage in these kind of broader issues, and also for advocates or public health practitioners as well to learn how to engage with patients on these issues is important. So the way I see it, it is a sort of two-way process rather than a one-way process. We sort of move along together rather than one lead the other.
Okay, that makes sense. And I think for Prabu and Derek, then the question is, what is unique about patients as advocates for climate action, and what roles can they play that other advocates cannot? Yeah.
Shall I?
Yes,
First?
please
All
go
right.
ahead.
So I think this notion of planetary health might be a bit too very detached from a patient's perspective, right? Because patients and survivors, family members, caregivers, the entire extended group of a patient, their immediate need is, what's the treatment, what's the diagnosis, how do I get out of this, how do I survive, will I survive, whatever, So planetary health is probably the furthest on their mind, right? It was for me too, I wasn't paying much attention. until, and if I get a chance, I'll share where I feel now I'm better connected. And so that's one. So I guess going forward, what's unique is as patients, survivors, family members, we don't feel that direct connection. So it might not be on the top priority item, especially when I'm undergoing treatment and for chronic, especially for chronic situation. So I guess one of the things we can do is how do we simplify this planetary health concept and knowledge so that it hits hard, right? It's directly. I think that's one area that we could all work together.
Makes sense. Derek, would you like to add on to what Prabhu said?
Yeah, I think I'd like to build on what Prabhu had mentioned. It's like for me, I think also the level of the public awareness on the link of climate and climate change and the public health is still a challenge, even in my experience, as I have experienced. I've been a community organizer, but this is also still the level of information and awareness of the public, of the community, relating to the climate, their public health is still a big challenge for us. And not only the public, but also there are several, if not many, of health professionals or health practitioners, especially those in the community, are still they need to enhance their education. They still need proper knowledge and information on climate, and it's linked to public health, because sometimes they just give you treatment that is I think it's inappropriate, or sometimes they diagnose your diseases inappropriately. Like in my experience, they would say that respiratory diseases or skin rashes are related to sanitation. It may be true, but have they investigated? Have they conducted investigation on what kind of environment are the community have? Like in my community, we have a coal-fired power plant in operating in the community. So it's easy to diagnose a sickness, but sometimes it could be not related. No, it cannot solve the problem just like that. So I think public engagement, education in the perspectives of climate and its link to health is important. It strengthens the perspective of what are the determinants of health. The environmental determinants, the social determinants of health. So I think in that area, I would say that we have to have a proper knowledge and education first to engage the public also in this uh, issue.
Thank you, Derek. And I think from all the points, I've realized that there is a need to push for more evidence-based research to understand the climate and health links, right? And Prabhu, you said that this is such a vast, broad concept that sometimes it just seems abstract. So how do we simplify it for patients and their families? And I think that brings us to my next question. So of course, the experience of patients and climate change varies across contexts, across countries, right? And for example, your experience in Singapore might be different from Derek's experience in the Philippines. So what insights or lessons can we glean from such experiences? Like, are there commonalities or connections that maybe we can explore further? Prabhu, if you want to start off with that, yeah.
Sure. Thank you. So first of all, residing in Singapore and being treated in the Singapore healthcare system, I'm very grateful for what we have in terms of the clinical expertise and medical technology. Coupled with that, in relation to our topic, is the existence of our national parks. Right? We have got clearly, carefully curated national parks, which I'm a beneficiary of. And so that's another plus point that's available for us. to be, to utilize.
Mm.
So in that sense, overall, from that perspective, I'm thankful that I have such benefits and assets, to avail. That's my situation. Talking to other patient advocates and survivors when I meet them in seminars or conferences, then I know it may not be the case in all places.
Mm.
So I guess if we look at a holistic, a broad perspective, it is so important to have nature
Yeah.
embedded together with
Yeah.
where we are receiving treatment and where we are receiving medical care.
Mhm.
Yeah.
Yeah. I think we were talking about the concept of forest bathing right before we started the session. Do you maybe want to elaborate a little bit of the sort of benefits that you receive from forest bathing for people who are not aware of that and other nature-based solutions? Yeah.
Sure. Thank you for that question. So 6 years ago, when I was undergoing treatment for colorectal cancer, I did a lot of reading on, how do I get out of this, right? And one of the many items in the normal public domain library that I found was the concept of forest bathing, which is a 40-year-old Japanese concept, Shinrin Yuku, where the Japanese found out that immersing yourself in nature actually helps you. And there's a whole set of material around that. 20 years later, the Western medical world then found evidence of the benefits of forest bathing or immersing in nature, basically. So I'm a practitioner, and I go forest bathe. Many think that you have to change to swimming trunk to go into the forest, but it's not like that. You go and soak yourself in what the plants give out in a forested area. So, incidentally, the latest healthcare institution in Singapore, Woodlands Health, has already built this into their infrastructure. When they were building Woodlands Health, they also merged it with the Mandai Wildlife Forest, yes. So now it's designed in such a way that patients get benefit of the forest, the whatever comes out from the forest, right? Including something called phytoncides. Phytoncides are supposed to be beneficial. It's a natural cancer killer. Yeah. So with Woodlands Health doing that, I'm so happy to see it's being built in when new hospitals are being built. Yeah. My hope is that for the existing health institutions, you can't bring a whole forest next to you, but you could create mini experiences within the hospital institution. So imagine a patient walks into a room or something where it's like a mini forest, right? A bit like the experience we get at Changi Airport, right? You can go in and experience the butterfly garden and all. So I'm hoping that we can have both policy and mindset support, whereby existing health institutions will also invest when they are doing restructuring and refurbishing small rooms. We could call it the forest bathing room or something. Yeah, I hope that can happen.
Yeah, for sure. And thank you so much for sharing your experience with nature-based healing. And Derek, I would want to move on to you and also understand from your experience in the Philippines, and just the experience of patients and climate change and how it was different for you versus what you just heard from Prabu.
Yeah, I think we have much to learn from from Singapore if we are looking for like unique experiences. Although I think we both countries have been vulnerable, no, to climate impacts, but they differ from how we address this present situation. Like in the Philippines, I think we can learn from Singapore on how their health infrastructure is being prioritized, and how they include environment, like prioritize environment in maintaining the environment in creating their or building their healthcare systems, or including the nature environment as a matter of a treatment, because these are the important aspects of climate justice right now. It's like, for us, as in the Philippines, our healthcare system is very much patterned to Western medicines. Like, if you get sick, you just go to hospital, and if you do not have money, you cannot access the right treatment. But there are a lot of other alternative medicines, like the environment itself. They can provide specific medicines. How our indigenous knowledges, how do we treat our communities before they can be treated with those kinds of alternative medicines and indigenous knowledge that we have been practicing for many years, but these were all being degraded because of the Western pattern of healthcare in the Philippines. So I think these are the things that we should also consider, especially right now. That's why we have to protect the environment. We have to consider climate as part of our addressing the problem in healthcare. Thank you.
Right. Thank you, Derek, for sharing your experience. I think, Yoong, then I have a question for you. Since you've been working in this space for a very long time, what do you think are like the best practices for introducing planetary health in communities then? So that this abstract concept becomes much more easier to digest for the patient as well as their caregivers.
Also another hard question. But I think collectively we all agree on this table and in the Zoom space that patient voices are important. Patient experiences voices are important. And I think we don't really have to say that much about it. But I would like to just expand a bit on how do other people look at patient engagement and patient involvement. The core issue between sort of different stakeholders is basically a value judgment. There's difference in value, like what the patient value, what the healthcare authorities value,
Right.
etc. Right. So coming to a sort of common ground on that, and I think that's important to work together to come to a common ground before we start working on common issues and common problems.
Right.
Right. But I think at a systematic level, as a sort of academic or a researcher, one of the easiest things we can do is just to include patients or patient organization or patient leaders within our research projects, right? So these are including them not as participants or recipients of the research, but also co-designing our research design, clinical trials, etc. So that's a really powerful way of including patient voices in the work we do, right? And again, coming out from those research projects, it can be many different things, right? They can be co-authors, they can be included in publications, etc., grants, etc. So those are tangible things that individually as researchers we can do. But systematically, there needs to be a sort of, I would say, maybe a formalized platform for patients to come as peers within the healthcare space to give their opinions and input. And this is really important. Again, because within the region, especially Southeast Asia or maybe Asia Pacific, our health systems are often very paternalistic, right? And that's no fault of anybody. It's just how our cultures grew over time, right? But there is a need to sort of change this mindset now. That we have to include our patients in the decision making, and this is not just at clinical level, but also the broader policy level and for planetary health. So coming back to the question, how do we do it? And I do like Prabu's idea of the question is how do we simplify this concept into something that's sort of bite size? And I think one of the ways we do it is actually through disease areas. So we have established through my previous comment that almost all these areas have some link to climate change and planetary health, right? For example, as Derek mentioned, maybe asthma and air pollution and skin rashes, etc. even cancer, right? UV exposure and things like that. So there are different links, and we have to sort of figure out how to exploit or sort of use these links to bring out that planetary health or climate change focus in these conversations, right? So they're using different disease areas as the channel to sort of bring in these broader concepts, will help to sensitize both the practitioners, clinicians, and patients to this idea. And I think, unfortunately, patient engagement and palliative health, all things healthcare, it is a sort of step-by-step process. It's not an overnight solution. You can't just change everyone's mindset, again, because of value judgment. But I think if we start to plant these ideas within individual work as well as supporting formalized platform for engagement, I think we can bring it very far.
Yeah, I agree with you, Yoong, and I think this is why it's very important to have patient-led agendas, especially for planetary health. I think we have a question online from one of the participants, and that question says that what are some concrete examples where patients' inputs have influenced policies we see today? And I think a follow-up question would be, how can we implement these lessons that we have learned from other like groups, and how we can use them for pushing planetary health? Yeah, Yoong, if you want to start off with that.
Yeah, so probably taking an example of some different disease areas, one of the sort of common ways of patient can be included in this decision making is through committees. So a lot of drug safety committees now have patient engagement groups or patient representatives. Even drug development groups in the US, there's a lot of drug development groups that the FDA conducts. Even the EMA, the European Medicines Agency, as well, has a whole stakeholder and public engagement division or unit that does this. Right, they hold regular meetings with patient groups, and these are not just sort of public engagement meetings. These are really meetings that they are part of. They are member of committees, etc. Pharmacovigilance activities, detecting adverse drug effects. They all rely on sort of, at the moment, rely on practitioner reports, right? But patients can also participate in this to highlight different adverse effects to doctors and to change policy around recommendation of the doses, etc. So those are the few things that patient are or can be included as well.
Yeah, please.
So I want to add that within the Sing Health cluster, for example, me and my fellow volunteers from SPAN, Sing Health Patient Advocacy Network, do get invited to give inputs and provide our perspectives. So that's one. Second, there are one or two instances where we really got plugged into the core, if I may use the word, core of discussions. So I think it's happening, and I hope there'll be more of such happening. So in other words, and I think you said so, patients are not just patients, but see them as patients plus or plus, right? Which means that they may be able to also equally participate with policymakers, researchers, and all. They may not be fully qualified in that area, but they could provide an angle or perspective to this important work that needs to be done, research and policy, etc. So that's my thought at the moment.
Derek, would you like to add anything to that? Share any concrete examples where you've seen that patients' inputs have actually influenced policies that we see today?
Yeah, I think I believe that harnessing the voices of the patients through their lived experiences, I think that would give some relatable and meaningful reforms in the healthcare system. And also another one is about the integration of environmental sustainability into our healthcare systems or healthcare policies. It should be a matter of urgency at the context, in the context of climate crisis. So I think we should also recognize the experiences of alternative and indigenous communities so that it could, related to community practices. So we could involve the whole community in taking care of the health of the community. So because right now it's not being recognized, because we always see that for medical aspects, for medical practices, it is exclusive for the medical practitioners. The community is not being they're not yet recognized as part of the prospective community healthcare professionals. That's all. Thank you.
Thank you, Derek. I think we're also having, we have a lot of questions on the chat. I think one question that stands out again is that the delivery of sustainable and climate conscious care seems to be the last priority of healthcare providers. And also one of the last priorities for patients as well. So how can health providers actually talk with patients about planetary health without adding burden? And how can patients be more open to the idea of alternate therapies or just understanding about the climate change scenario as well? Yeah. Prabhu, do you want to start off?
Yeah, sure. So I would like to start off from my own experience, and not because of my chronic that I'm cleared, right? I'm now in remission, but because I'm diabetic, and therefore I have a whole bunch of tablets that I have to collect, every time I go see the doctor, which could be quarterly or 6 months once, depending on how good boy I've been in complying with consumption of the medication, right? And I get this whole quarterly supply, sometimes half a year supply, but I'll cut it to quarterly, right? So and I've been doing that for many years now, 2 decades actually. So one of the challenges I have is if a medicine gets changed, I'm left with stock from the earlier because I cannot return them for patient safety reasons, right? So technically it's like wasted medicine. So that's one. And I think for patients, if there can be avenues for them to collect smaller quantities of medication conveniently, because the reason why patients, I think, collect one whole stock is because it's not convenient for them to go collect more frequently. So if there can be a mechanism of, smaller kitted packs or something, which can happen, I'll share in a moment, learning from another sector that we could maybe borrow from. But so that's one. And because if this is not, if the medication surplus is not properly disposed of, it can become an environmental issue, right? If it gets into the soil and all that. Maybe in Singapore, we throw it into the bin, it gets incinerated straight away. But in other places, maybe the patients may just bury it on the ground, So I think that's something that we could, not just in Singapore, but and especially in this part of the world, educate. Yeah. The point I wanted to make about learning from another sector, because my early career was in manufacturing, and there was always this issue of raw materials that comes to a factory and gets converted to finished goods. And the challenge is this: you must have raw materials, otherwise the factory stops. It's a lot of losses, right? People waiting for nothing to do because there is some component missing. But on the other hand, if you bring in a lot, then you may have wastage and storage costs and all. So that has been a big issue with the manufacturing sector, and probably still is. And one of the major breakthroughs that happened was to do small kits, kitted in small kits, so that it's used just in time. So there's a whole set of manufacturing practices that evolved, right? I'm wondering if we can, by way of researching correlated to the manufacturing sector, what can we learn and implement in the healthcare sector? Because if you are issuing medication to a patient, it's like some ways issuing components to a factory, which is the patient, right? So maybe we could learn from the kitting principles, KITTING, and do it. And it will reduce wastage and reduce damage to the environment if surpluses are thrown away because there won't be that much surpluses. We are kicking it, right? So that's what comes to my mind immediately
Yeah.
based on the question.
Yeah, that makes sense. Derek, do you want to add on to that, especially as from the side of a caregiver, and also that you have also experienced the impacts of climate change, right? So how would you have preferred that healthcare providers approached your situation when they were talking to you as a caregiver as well as a patient?
Yeah, I think in my experience, what important lesson I had was that I've been engaging patients, my community as a patient, and my family, my mom, myself as as a stakeholder also in by providing transparent information, and so that we could have our uninformed choices on how we are going to be treated and what kind of treatment are we going to take. We have to also, it includes involving important the sustainable practices, healthcare practices. It's like a partnership. Like I'm not the mindset of being a patient. You're not just a patient, but you are also a part of the stakeholder that should have a decision. This decision should come from an informed informed decision. Like information should be accessible, no, should be you should have an access to that. And I think for me it is important also to have reforms in the healthcare system. We have to build a resilient healthcare system, which includes the environment. We should integrate environmental sustainability, and that we have to have transparent communication. And important also is the participatory platforms. So I think those are the important values and lessons that I have acquired from my experience as a patient, as a caregiver, and as a community organizer. Thank you.
Thank you for sharing, Derek. There's also another question on the chat that just came in from Rachel. She works at the intersection of nature health intersection, and she asked, of all the possible interventions, and of course there are heaps, on what is one high priority intervention to change the physical environment that you would recommend. So it is directed to, of course, understanding the local communities in Philippines for Derek, and also the Singapore urban population. In Yoong, you can also start us off, and then Prabu can add, and then Derek can.
What's the question again?
Oh yeah, so she asked that what is that one possible intervention that is like high priority to change the physical environment that you would recommend?
I think probably coming from Prabu's idea of building these mini forests in sort of hospitals or forest building, I think that's actually quite tangible. And again, there's evidence really proving that there is benefits to patients, etc. So I think getting that done is not that hard, right? It's a lot of education, awareness, and advocacy, bringing these ideas to the authorities, etc. But even more so, I think I do like Prabu's idea of learning from different sectors. So also learning from different sectors, we also have to work with other sectors, right? So building this sort of mini forest within hospitals must also involve other different stakeholders, so not just the doctors that advocates for it, or the patient that wants it, but also maybe the biomedical engineers, the infrastructure people, etc. So they have to also buy in, I think. So I think if we are talking about this forest building that has already proven benefits, that's sort of I think relatively a low-hanging fruit. Again, because a lot of our hospitals do have green areas already, right? You know, it's HGH with tiny little parks. Maybe just upgrading this a little bit better based on experiences, based on evidence, etc. So that would be sort of my first thought.
I concur. I think because I think the question says existing infrastructure, how do we adapt really quickly, right? So find rooms or spaces maybe unused and plant some indoor plants or whatever, right? So that's one. But one step back, I think the decision makers may not be so keen to work on this because there are so many other priorities that need to be worked on. So I think some kind of a research, local, Asian-based research to provide evidence that indeed it does help. Nature, eco healing does help to complement the mainstream medical. It doesn't replace, but complement, right? I think if we have those kind of evidence from research, then it will further expedite the people who need to make decisions to say, okay, let's convert that room that's been lying around doing nothing. Let's just bring in some plants and make it available for patients to go there during their whatever time, So that's my response.
Yeah. Derek, would you want to add?
Yeah.
Okay, go ahead.
Yeah, I think for me, apart from other than the climate adaptation measures, which includes building resilient healthcare systems, for me, what is important for now is that to always remember the do no harm goal. It's like doing away with policies and with projects that exacerbates our climate condition, our climate crisis right now. Like if we are building fossil fuel industries, despite the despite the problem, despite the emissions, which resulting to more harms to the communities and compromising their health, public health. I think that's important for me because coming from the community where fossil fuel industries are operating with impunity, it's and no accountability has been corporations are not, they are not accountable for what they have been doing to the community and to the environment. This is very important for policy making, people, like for the authorities, for the government, for the corporations. They have to recognize them. And second is that, as I have mentioned, we have to we have to implement climate adaptation measures that is resilient, that is a healthcare system that is resilient and accessible, which highlights patient participation also. I think that's all for now.
Thank you, Derek. Those are extremely powerful points. And okay, before we move on, I want to just ask if there are any questions in the room for our panelists. Yes, go ahead, Suki.
Just a quick question, because this topic is very interesting, especially for me. I'm a medical doctor as well. And I have my father is also a colorectal cancer survivor. So your experience resonates very much with me. But the thing is, the translation from research to policy, for me, is a very intricate area. Like for example, I have a lot of questions like what's this specification or minimum infrastructure to build this area to really significantly improve the health outcome that we expect, something like that. That's maybe the research focus that needs to be refined further. That's one. The second one is, who would be an organization that would be able to deliver this research and influence the policy. I know, I understand that patients should be one of the components, but have we had any discussion around that thinking?
We haven't actually, but yeah, Yoong, do you want to take that?
I think my first thought would be actually, again, like Muskaan mentioned, a lot of initiatives can and should be patient-led. But I think at a sort of broader level, it is a collective effort that requires, unfortunately, multiple people coming together. But I also want to emphasize that sometimes to move things forward, not just within the healthcare space or this sort of preventive health space, we do need to identify champions. right? And I think this is also very important. So patient representative, patient leaders are the natural champions for this kind of work, as well as maybe some clinicians or healthcare authorities. But it's not just about identifying or getting a patient. You have to get a suitable profile of the patient, of a champion, right? So I believe, in the patient organization or the patient groups, they also have different profiles, like us in the healthcare space. So I think identifying the correct people to sort of push these things is important, as opposed to just getting the evidence, etc. And as you will know as well, sort of the policy translation is a very complicated process. It not just involves the evidence or just the people pushing for it. It involves the timing, etc. So I think it has to do a little bit of luck as well, luck and timing. But again, collectively with different champions, with different patient-led initiatives, I think we can push this through in that sense as well. So I'm not entirely sure whether I answered your question. It is another hard question.
Thank you so much for that question. And as we near the end, may I invite each of you to share one closing line that could be like a key message that you want the audience to take home from today's session. Yeah. Derek, do you want to start with that?
Yeah. Okay. Yeah. Thank you again for inviting me here, and thank you for all the participants who have joined us in this very meaningful discussion. I think as a patient, as a community member, and as an advocate, as a climate advocate, I believe number one we should remember is about doing away uh, with policies that would exacerbate the harm, that would really make our public health worse, and that to the point that we cannot really manage already, because what happens to the poor people, what happens to the community, it's really worse. They do not have, if they do not have access to medical care, because the medical care is being controlled by corporations also. So this is really the problem right now, especially with the climate crisis in the background. So I think it's very important to educate people, to engage people through their giving them enough and appropriate knowledge and information. Awareness plays a crucial part, especially when engaging our patients. Likewise, we have to really embark on building a climate resilient healthcare systems that is accessible. We have to engage patients as part of the stakeholders and communities in building these climate resilient healthcare systems. So I think that's really important for me right now. That's all maybe. Thank you.
Thank you, Derek. Prabu, do you want to go next?
Sure. I hope to see, in the future, where patients are not just recipients of care, right? Passive recipients, but active contributors, active players in the healthcare sector. And I think I made an interesting point. There are patients with different competencies or capabilities. So the patients who are better equipped should come forth and provide that leadership for patient advocacy and not take a passive backseat, and therefore help the entire sector through the voice of the patient, active voice of the patient. That's my.
Thank you, Prabu.
Sure.
Probably just sort of 2 points rather than one key message. So I think I'm not very sure who are the participants online, but I think I would encourage all of us as sort of public health practitioners to engage more with patients, not as patients, but as partners, those at least co-partners in developing solutions. And I think that perspective really changes, the perspective on how do we approach on solution really changes once you learn from them, right? So that's one point I want to make. And second, because climate change is such a multi-sectoral problem, our solutions also need to be multi-sectoral, go beyond the few people in this room and in the Zoom space, we also have to engage with different sectors, education, transport, etc. So I think collectively, our voices would be stronger if we work together. That's all.
Thank you, Yoong. So yes, thank you, Prabu, Derek, and Yoong for your powerful insights, and thank you to our audience here and online for your thoughtful engagement. I think the takeaways from this session for me is that awareness is very important, as Derek mentioned. That's why there is a need to push for more evidence-based research now to understand the climate and health risk. Patients need to be contributors and partners. And also we need to engage different sectors to come up with really strong solutions. So this concludes our episode today, and please stay tuned for our next episode, and let's continue amplifying patient voices for planetary health. Have a wonderful afternoon. Thank you so much.
Thank you.
Thank you. Maraming salamat.
Thank you, Derek. Salamat.